do with the $1 million grant?
I would open my own birthing center.
Okay, a birthing center.
A birthing center,
Is
and
there a birthing center in Southern Illinois? Okay.
just
Hmm.
just a couple of hospitals, which
Aren't very good. Let's be honest.
well, have all of our rural communities that they have babies out in rural communities too. Like there's places I never even heard of. But honestly, it would be that, and I would pick a place that was closer to those rural communities. For instance, like Cairo, Illinois, or in those down in that area, or even in like the people that are from like the Harrisburg area. Those communities need somewhere safe to birth their babies. And that is probably my number one thing that I would do. But to give an idea of what a couple other things that I struggle with that answer is training Black doulas. Training for Black doulas. I would create a scholarship fund and train or mentor aspiring Black nurses. And I would also pursue legislation.
Okay.
So just to give an idea of the different perspectives that I have on the things that I personally would like to change, those would be it. I would create my own table.
Okay. So communities, legislation, increasing the amount of healthcare that is available to rural communities in general. Because that's super vital, because babies out there, like rural communities, pay taxes and they go directly into the United States government, a bunch of these things. And if we solve these issues on the micro level, we don't have nearly as many issues on the macro level.
Yeah.
Because babies they develop so much within like the first few months.
Yeah.
And that's pivotal to their growth. And then there are also, from my research, there are also some complications that can, affect the child. And now we're spending more resources on putting them in a home where they're trying to get care. Like my mom, I have a very special place in my heart for like CNAs and nurses, because my sister, she went to CNA school. Shout out to Delilah. My mom, she's always been in caregiving. And a lot of times as African Americans, that's where they stop. But they have such big hearts that they stay in these places. Like my mom was telling me, like she worked in a home where they were all blind, like, and their families had left them. Like, this is where your community dollars in a lot of ways are going. But a lot of these issues that are affecting the disabled happen prior to birth. Like I heard, like as early as like, 37 weeks, a doula can help and start really making those changes and start getting in there and providing that care and that opportunity for,